Cuomo declaring a state of emergency and announcing new cases of coronavirus here in New York.
We have 21 new cases that we found, so we're a total of 76 in the state of New York right now. We have 11 in New York City, 57 in Westchester County, 2 in Rockland County, 4 in Nassau County, and 2 in Saratoga County. The 2 in Saratoga County are obviously new. The additional numbers are 7 additional in New York City from yesterday and 23 additional in Westchester.
We are going to sort through the latest developments from every angle with our team of reporters and analysts as we look at the Vice President arriving just a short time ago in West Palm Beach. He'll be meeting with cruise line directors and the like down there to discuss things. Let's start, though, with NBC News medical correspondent Dr. John Torres, who's here in studio with me. Big welcome to you. Let's get all the facts going here. Where do we stand in the fight against coronavirus? Is there any end in sight?
So I think there's going to be an end in sight eventually, but right now the name of the game is what we call containment, trying to keep it as contained as possible, and you can see the numbers increasing across the country. What I've been talking about for the past few days is you're going to see an increase in numbers, but that's a lot because of the new tests that are coming out. And so people that had it that we didn't know about all of a sudden are going to get tested, but we're also seeing a spread in it and a spread around the country, and so that's where the concern's coming in, and I think that's where you're starting to hear all these governors coming up saying, hey, I'm going to declare a state of emergency so I can try and keep it as contained as possible.
And I'm curious about a vaccination. Where do we stand on that?
So the vaccination is in process, and what they're doing, if you think about normal vaccinations, usually takes 5 to 20 years to develop. It's very rapidly here that they've been able to get the vaccination. They're going to start testing in people. They think within 2 or 3 months they'll have it through that. Then they need to start looking at it a little harder, making sure it's safe in the production process. So what they're telling us, the NIH is saying 12 months to 18 months. And that's a very fast time for a vaccine, but not fast enough for a lot of people right now because of all the concern with coronavirus.
Real quickly, Governor Andrew Cuomo updating the New York State numbers, not only doing that, but declaring a state of emergency. As I was coming into this broadcast, there were 45 confirmed cases. Now there's 76. How concerning is that for you, considering how densely populated this state is?
And he said 11 in New York City, and that's probably the more concerning thing because it's such a populated area that people are passing each other. And we know we had that one gentleman that went to work, he went through the trains everywhere, and he ended up passing it to a lot of people. Sometimes that's going to happen. Those super spreaders we talk about could be giving it to a lot of people because they're in close proximity. The hard part is keeping them quarantined, some of that self-quarantine, keeping them away from everybody else, and hopefully stopping the spread of this, or at least reducing it as best we can.